Hello, everyone, and welcome back. Today, we need to discuss something that's going to affect millions of Americans starting in just a few weeks. We're talking about upcoming Medicare adjustments that could potentially wipe out your Social Security cost of living increase, and in some situations, leave you with even less money than you have right now. You've likely heard the good news. Social Security recipients are getting a 2.8% cost of living adjustment. For the average beneficiary, that translates to roughly an extra $50 per month. Sounds great, right? But here's what they're not telling you in those headlines. While one hand is giving you that increase, the other hand is simultaneously reaching into your pocket through Medicare premium hikes that are scheduled to take effect at exactly the same time. This isn't a coincidence, and it's not a new phenomenon either. This happens year after year, but 2026 is shaping up to be particularly challenging for seniors on fixed incomes. Let me explain something crucial that many people don't fully understand. Medicare is not a set it and forget it program. It's actually one of the most dynamic government systems out there. Every single year, without fail, there are significant changes across multiple dimensions. The Centers for Medicare and Medicaid Services, or CMS, adjust premiums, deductibles, co-payments, and coinsurance rates. They modify coverage rules, change payment structures for providers, and update what services are included or excluded. On top of that, private insurance companies that offer Medicare Advantage and Part D plans make their own changes to networks, formularies, and benefit packages. What this means for you is startling. Even if your health status remains stable and your income doesn't change at all, your out-of-pocket healthcare costs can swing dramatically from one year to the next. Yet despite CMS publishing detailed fact sheets every fall outlining these changes, the vast majority of Medicare beneficiaries either don't see this information or don't take the time to understand what it means for their personal situation. So, let's change that right now. Let me walk you through exactly what's coming in 2026. Let's start with Medicare Part A, which primarily covers inpatient hospital stays, skilled nursing facilities, hospice care, inpatient rehabilitation, and certain home health services. Here's some good news first. Approximately 99% of Medicare beneficiaries don't pay a premium for Part A because they've accumulated at least 40 quarters of work history where they paid Medicare taxes. If you fall into this category, you can skip ahead. However, if you're in that 1% who does pay a Part A premium, brace yourself. These premiums are increasing by 9.1% for 2026. If you qualify for the reduced premium rate, you're looking at a $26 monthly increase, bringing your total to $311 per month. If you're paying the full premium, that's jumping up $47 to $565 per month. That's a substantial hit to your monthly budget. Additionally, Part A deductibles are climbing across the board. The inpatient hospital deductible is increasing, as are the daily coinsurance amounts for extended hospital stays and skilled nursing facilities. These might seem like small numbers on paper, but if you actually need to use these services, these increases add up quickly and can create financial stress at a time when you're already dealing with health challenges. Now let's talk about Part B, which is where most Medicare beneficiaries will feel the impact. Part B covers physician services, outpatient hospital care, certain home health services, durable medical equipment like walkers and wheelchairs, and various preventive services. The standard Part B premium is increasing by 9.7% in 2026. That means it's jumping from $174.70 per month to $185 per month. That's an increase of $10.30 every single month, or roughly $124 over the course of the year. Remember the $50 monthly increase from your Social Security COLA? Well, this Part B premium hike alone eats up more than 20% of that increase before you've seen any other changes. But wait, there's more. The annual Part B deductible is also rising by just over 10%, going from $257 to $283. That's an additional $26 you'll need to pay out of pocket before Medicare even starts covering your Part B services each year. Now, I know some of you are subject to income-related monthly adjustment amounts, or IRMAA, which means you pay higher premiums based on your income from 2 years ago. If that applies to you, these increases are even more significant. The IRMA brackets are adjusted annually, and high-income beneficiaries can pay several $100s per month for Part B coverage. Part D, which covers prescription medications, is where things get really complicated and individualized. Unlike Parts A and B, which have standardized premiums set by the federal government, Part D premiums vary significantly by plan and by geographic region. Here's what makes this particularly tricky. Your Part D costs aren't just about the premium. You also need to consider your specific medications and how they're covered under each plan's formulary. A plan with a lower premium might actually cost you more overall if your medications are placed in higher tiers or if the plan has stricter prior authorization requirements. For 2026, many Part D plans are adjusting their formularies, changing which pharmacies are in network, and modifying their tier structures. Some medications that were covered generously last year might face higher copays or require step therapy protocols where you have to try cheaper alternatives first. Higher income beneficiaries also face IRMAA surcharges on Part D, and these adjustment amounts are increasing as well. Here's where the situation gets even more concerning. While premiums and deductibles are rising, many major insurance companies are simultaneously reducing their Medicare footprint. This is happening largely because these companies claim they're losing money on Medicare Advantage and Part D plans. Though the exact reasons are complex and often debated, major insurers like United Healthcare, Humana, and Aetna have announced significant pullbacks for 2026. United Healthcare is eliminating Medicare Advantage plans in 109 counties, affecting approximately 180,000 beneficiaries. Humana is completely withdrawing from 2 states and pulling out of 4% of the counties where they currently operate. Aetna is exiting 1 entire state and discontinuing Part D coverage in over 100 counties across the country. What does this mean for you? If you're in one of these affected areas, you might receive a notice that your current plan is being discontinued. Even if your plan survives, the reduced competition could lead to fewer choices, narrower provider networks, and potentially higher costs as remaining insurers have less incentive to compete aggressively on price. Some plans are reducing extra benefits like gym memberships, over-the-counter allowances, dental coverage, and vision care. Others are tightening their networks, meaning doctors and specialists you've been seeing might no longer be covered, forcing you to switch providers or pay out-of-network rates. By law, your Medicare plan is required to send you an annual notice of change, or ANOC, by September 30th each year. This document outlines any modifications to your coverage, costs, benefits, or network that will take effect on January 1st. I'm going to be honest with you. Most people don't read these letters. They're dense, filled with insurance jargon, and frankly, they're overwhelming. Many get thrown away, unopened, or mixed in with other mail and forgotten. But this year, more than ever, you need to find that letter and read it carefully. Look for sections about premium changes, deductible increases, formulary modifications, and network updates. Pay special attention to whether your doctors are still in network and whether your medications are still covered at the same cost-sharing levels. If you can't find your ANOC, don't panic. You can request another copy directly from your insurance company. Most plans also post these documents on their websites, and you can often access them through your online member portal if you have an account set up. The good news is that we're currently in the Medicare open enrollment period, which runs through December 7th. During this window, you have the power to make changes to your Medicare coverage without needing a qualifying life event or special circumstance. This is your opportunity to be proactive rather than reactive. Even if your current plan is still available and seems acceptable, I strongly encourage you to shop around. With all the changes happening across the industry, there's a real possibility that a different plan might serve you better in 2026. Here's what you should evaluate. First, make a complete list of your current medications, including dosages and how often you refill them. This is critical because drug coverage varies dramatically between plans. Second, identify all the doctors and specialists you see regularly. Make sure any plan you're considering includes them in its network. Switching plans only to discover your oncologist or cardiologist isn't covered is a nightmare you want to avoid. Third, estimate your healthcare utilization for the coming year. Do you anticipate any surgeries or procedures? Are you generally healthy and only need preventive care? Your expected usage should influence whether you prioritize lower premiums with higher cost sharing or higher premiums with more comprehensive coverage. Fourth, look beyond the premium. A plan with a $20 lower monthly premium might cost you hundreds more in copays and coinsurance throughout the year. You need to calculate your total estimated annual cost, not just the monthly premium. Fifth, consider getting professional help. There are licensed insurance agents who specialize in Medicare and can provide free consultations. They have access to comparison tools that can model your costs across dozens of plans based on your specific medications and healthcare needs. This service doesn't cost you anything because agents are paid by the insurance companies, not by you. Let's zoom out for a moment and talk about the larger financial implications. Healthcare costs are one of the biggest and most unpredictable expenses in retirement. Studies consistently show that a couple retiring today can expect to spend over $300,000 on healthcare throughout their retirement years, and that number keeps climbing. What we're seeing with these 2026 Medicare changes is part of a broader trend. Healthcare costs in America are rising faster than general inflation, and Medicare is struggling to keep pace while remaining financially sustainable. This creates a squeeze where beneficiaries face higher costs even as their fixed incomes barely keep up. This is why it's so important to treat your Medicare choices as a critical financial decision, not just a healthcare decision. The plan you choose can literally make a difference of thousands of dollars per year in your budget. Beyond choosing the right Medicare plan, there are other strategies you can employ to protect your finances. Look into Medicare savings programs. If your income is modest, you might qualify for state programs that help pay Medicare premiums, deductibles, and copayments. Many people who are eligible don't even know these programs exist. Investigate prescription assistance programs. Pharmaceutical companies offer patient assistance programs that can provide medications at reduced costs or even free for those who qualify. Additionally, some states have their own prescription drug assistance programs. Use generic medications when possible. Ask your doctor if generic alternatives are available for your brand name medications. The savings can be substantial, often 80% or more. Consider mail order pharmacies. Many Part D plans offer lower copays if you use their mail order services for maintenance medications you take regularly. Take advantage of preventive services. Medicare covers many preventive screenings and services at no cost. Using these can help catch health issues early when they're less expensive to treat. Review your Medigap policy if you have one. If you're on original Medicare with a Medigap supplement, review whether you have the right level of coverage. You might be overinsured or underinsured. I want to emphasize this. December 7th is not a soft deadline. After that date passes, you're generally locked into your choices for the entire year unless you experience a qualifying life event like moving to a new area or losing other coverage. If your plan is being discontinued and you don't actively choose a new one, Medicare will assign you to a replacement plan, but it might not be the best option for your needs. Don't let that happen. Take control of the situation. Even if the process feels daunting, remember that making no decision is still making a decision, and it's usually the worst one. Spending a few hours now comparing plans and making an informed choice could save you thousands of dollars and countless headaches throughout 2026. The intersection of rising Medicare costs and modest Social Security increases creates a financial challenge that millions of seniors will face in the coming year. But knowledge is power, and now you have the information you need to navigate these changes effectively. Don't let the complexity paralyze you. Break it down into manageable steps. Find and read your annual notice of change, list your medications and doctors, compare available plans, and make your selection before December 7th. Your health and financial security are too important to leave to chance. Take action now while you still have the opportunity to make changes. Thank you for watching, and I hope this information helps you make the best possible decisions for your situation. Stay informed, stay proactive, and take care of yourselves.